Hello everyone, welcome to my channel nursing.com. Today we are going to learn about bronchopneumonia in pediatrics. तो चलिए शुरू करते हैं इंट्रोडक्शन से. Bronchopneumonia is the inflammation of the lungs parenchymal cells. Pneumonia increase the mortality and morbidity of neonates. Mortality means death rate and morbidity means disease rate. Bronchopneumonia death rate and disease rate को increase करता है. Classification based on causative agent, in that bacterial bronchopneumonia, viral bronchopneumonia and fungal bronchopneumonia. Classification based on severity, in that mild bronchopneumonia, moderate bronchopneumonia and severe bronchopneumonia. Classification based on location, इन्फेक्शन कौन से पार्ट में हुआ है उसके अकॉर्डिंग क्लासिफिकेशन. इन दैट ब्रोंकोन्यूमोनिया, it is the inflammation of lungs, often involving bronchioles and surrounding lung tissue. Lobar bronchopneumonia, in that inflammation of one or more lung lobes. Interstitial bronchopneumonia, it is the inflammation and scarring in the interstitial space of the lungs. Classification based on source of infection, in that hospital acquired pneumonia, community acquired pneumonia, opportunistic pneumonia, ventilated associated pneumonia, healthcare associated pneumonia and iatrogenic pneumonia means illness caused by medical examination or treatment. Etiology, in that bacterial infection like streptococcus, staphylococcus, klebsiella, pseudomonas, viral infection like adenovirus, rhinovirus, Haemophilus influenza, fungal infection like Candida albicans, protozoal infection, kerosene poisoning, aspiration of food, oily nasal drops. These are the etiology of bronchopneumonia. Risk factor: allergic history, family history, common cold, malnutrition, living in crowded and polluted area, low socioeconomic status, immunocompromised client, living in chemical factories. These are the risk factors of bronchopneumonia. Pathophysiology: infection enter into the body, then inflammation of alveoli, airway obstruction, alveolar damage, then hypoxia and hypercapnia. Systemic response and complications may show. Clinical features, in that fever, increased body temperature more than 100 degrees Celsius, chills, malaise means feeling of discomfort, illness or lack of well-being, dyspnea means shortness of breath, coughing, rusty sputum, rhonchi or rale sound, restlessness, irritability, nervousness. Hypoxia means lack of oxygen level in body's tissue and organ. Hypoxemia means lack of oxygen level in bloodstream. Hypercapnia means body cannot eliminate carbon dioxide from blood, causing it to build up. Clubbing of finger and nails. Respiratory acidosis, chest pain. These are the clinical features of bronchopneumonia. Diagnostic evaluation, in that history collection, physical examination, chest x-ray, sputum culture and sensitivity test, blood culture, serological test, CT scan of thorax, bronchoscopy. It is a procedure where a thin flexible tube with a camera inserted into the airway to diagnose and treat respiratory issues. Management, in that antibiotic therapy, tablet azithromycin, amoxicillin, cefixime, ciprofloxacin, bronchodilator, salbutamol, ipratropium bromide, antiallergic agent like cetirizine, levocetirizine, steroid therapy, hydrocortisone, dexamethasone. These are the medical treatment of bronchopneumonia. Nursing management, in that maintain patent airway by positioning and suctioning to provide high Fowler or orthopenic position, to assess vital sign, Start oxygen if necessary. Provide cool and calm environment. Nebulization, steam inhalation provide. To perform spirometry to assess how well your lungs work. To perform Valsalva maneuver technique, it is breathing exercise used to slow down heart rate. Diet management by high calorie protein, vitamin C and low fat diet. Give extra amount of fluid for liquefaction of cough. Prevention of airway obstruction. Advice to avoid polluted and crowded area. Thanks for watching.